distinguished members of the press, partners and citizens of Sierra Leone. The confirmation of 2 cases of Mpox in the country has prompted immediate action. As mandated by the Public Health Act and on behalf of the government of Sierra Leone, I am declaring a public health emergency.
On January 13, 2025, the Minister of Health, Dr. Austin Dembe, declared Mpox a national public health emergency in Sierra Leone. That decision followed the confirmation of 2 cases in the western area rural district. The declaration was made in consultation with President Dr. Julius Mathebio's technical teams from the Ministry of Health and the National Public Health Agency, as well as the international partners, including the World Health Organization, WHO. It came at a time for heightened public anxiety, fueled by misinformation and disinformation, as the world grappled with what could become the largest global Mpox outbreak in recorded history. Mpox, formerly known as monkeypox, is a viral zoonotic disease that causes fever, headaches, and painful skin lesions. It spread through close physical contact, either from infected animals to humans or from persons to person. In the current global outbreak, the virus has demonstrated new characteristics, including changes in its transmission patterns and symptom presentation. These shifts have made it more difficult to interrupt the chain of transmission and have changed traditional containment strategies.
Sierra Leone gets a history of actually dealing with outbreaks, but this one is new. It'll be new to we don't read in our books actually. These are the first big outbreak of Mpox, though we don't actually register a few cases a couple of years ago, more district and other side, but this has been the first big outbreak.
Say they ask me, doctor, after this year, I don't know if we use maintain again. So now one of the most emotional side, and you said that the first time they see the treat sick like this Mpox. So you don't know how to answer to that question. All what they do is just a reaction and not say. As long as he stick to the treatment plan, he come for the follow-up, he continue for do what he tell him, he will be fine.
The Mpox virus was first identified in 1958 in laboratory monkeys in Denmark, and human cases have been demonstrated since 1970, beginning in the Democratic Republic of Congo. The most recent and widespread outbreak began in May 2022, when the first case was reported in the United Kingdom. This marked the first time Mpox was detected in significant numbers outside of endemic regions. The virus quickly spread to over 120 countries, with transmission primarily occurring through close contact within social and sexual networks, particularly in urban centers. On July 23, 2022, WHO declared the outbreak a public health emergency of international concern. Under the 2005 International Health Regulation, the Global Health Agency's highest level alert. 10 months later, on May 11, 2023, the emergency was declared over after over 100,000 confirmed cases and over 200 deaths. But cases continued in smaller numbers until an outbreak of a new strain was declared in DRC in September 2023. On August 13, 2024, the Africa Centers for Disease Control and Prevention, or Africa CDC, declared the new outbreak a public health emergency of continental security after cases escalated across the continent.
This is not just another challenge. It's really a crisis that demands our collective action.
WHO followed suit by declaring it a public health emergency of international concern for the second time within 2 years. By this time, all three of Sierra Leone's Mano River Union neighbors, Guinea, Liberia, and Cote d'Ivoire, had already experienced cases of the virus. Sensing the high risks of an outbreak in the country, the National Public Health Emergency and the Ministry of Health in Sierra Leone announced measures geared towards either stopping the virus from entering or, if it enters, to ensure it does not spread out of control. And on January 10, 2025, the bad news came.
The emergency declaration demonstrates the government's commitment to safeguarding public health and readiness to respond decisively.
At this point, DRC, Burundi, and Uganda were the most affected by the virus in terms of cases in Africa, with DRC being the epicenter. By May, at the peak of the continental outbreak, Sierra Leone had confirmed a close to 2,000 active cases, with every one of its 16 districts now affected. The strain in transmission in Sierra Leone soon proved more virulent than was expected, resulting in a rare form of genital lesions in patients. Genome sequencing revealed that the virus was already mutating, further increasing the pressure on health authorities.
The Ebola Treatment Center, you know the magnitude, you know why you need to do more to actually end the outbreak. Now when you go 34, you go to a hospital, you go police hospital, you see people, we truly affected. You see their genital, and some of them not people that will ever lose them again.
Cases flared up, fatalities increased. With the help of partners like WHO, African CDC, and the West African Health Organization WAHO, Sierra Leone re-strategized. UNFPA's involvement was particularly crucial in ensuring that reproductive health services remain uninterrupted despite the strain on the healthcare system.
Just 2 cases. Before I say 4 months, we don't register over 5,000 cases, so that was alarming and very worrying to all of us and even to our partners.
Initially, the focus of the response was on the western area, Freetown and its environs, but cases were now increasing in the other districts.
The initial system we put in place with the Mpox now it's on, but we, get a protocol, verify the environment, staff. So we started getting cases around. So the first case we get now, we alert, then take sample, then confirm that Mpox. So I'll be served as one of the case management leads, by the Ministry of Programming and Medical Surveillance. So definitely after the incident manager will be on, so we be the case management lead. So what I'll be doing, I'll be set up the structure, as you say, all the one we identify as suspected patient, then we isolate them. Okay, and we also try to identify another area we will done aside for the one that we confirm for Mpox and for start treatment.
Despite its initial proactive preparations, Sierra Leone's Mpox response met challenges. The main one was delay in funding to implement its strategies at the initial stage of the response. This contributed to the rapid spread of the virus, partly thanks to the initial policy of home treatment.
When we start, we know what to do and we know how to do it, but the biggest challenge will be getting our resources. And so, for instance, the surveillance program be able, for instance, to detect cases. Also, one of the challenges now, like the movement of samples, and then also once the results come out, we will get serious challenge outside for actually admit them.
for stop community spread for any sickness wey contagious like Mpox. E get for require you for pick that person up from the community wey dem confirm am for Mpox, because if that person dey continue for that community e dey continue for the spread the disease.
This infectious disease facility at the 34 Military Hospital in Freetown was the first place to provide space for patients. And the head here is Dr. Captain Adama Kamara of the Republic of Sierra Leone Armed Forces Medical Corps.
Imagine we start with 13 beds, and at the day we get at least 50 or 60 patients when they come. And almost, I would say, 70% of them are critical, so you get for the precaution. Whether they get space, whether they get space. So in February, March, I was like almost all the time be overwhelmed with the number of cases that really come, whether for admission or not. So yes.
The NPHA and its partners eventually established over 700 beds countrywide. For Dr. Sekou Tijan, Medical Superintendent of the Port Loko Regional Hospital, the Mpox epidemic has been his biggest challenge as a medical doctor. He was in medical school when Sierra Leone battled the Ebola epidemic, but not even his experience as a volunteer in that response prepared him for what he had to deal with in this Mpox epidemic.
On the first case at the district, we'll be overwhelmed. I be worried because one, even though I'm not saying we don't experience outbreak before Ebola, but it don't take some time, and most of the staff they don't move out. You know, the new one they will get, they don't be a bit scared, they don't get too much skills. Then also, if you look at the hospital now, a referral hospital, it's very busy all the time. We can get patients where they can come direct to the wards, you know, especially the belly then because the Mpox they affect everybody, especially the belly then. So I'll be really feel worried. Let me healthcare workers, let me start not get infected because another be just worried.
Port Loko became one of the top 4 most affected districts by the virus, with 217 confirmed cases at the time of this interview on November 18, 2025. The work of Dr. Tijan and his team, with the support of the government and its partners, is a testament to the dedication shown by health workers across the country in the fight against this epidemic. Science and miracles are seen as conflicting, but through dedication, science can deliver what can pass as a miracle. This was the story of a pregnant woman very sickened by Mpox.
The count one belly man, I refer for one of the PhDs. Okay, that time me the consultants be the on call and Mr. be there around. Now be there. Now he called me. Then see Dr. Tijan. He said we don't get one belly man. We get classical symptoms like Mpox no more. You know, and I be genital, be very extensive. Now I never look at how we would deliver this woman. Okay, we didn't get extensive genital lesions. We like the pikin will be safe, the woman also will be safe. You know, and will not be one for crying on a theater at all. So that day I'll be really worried. I'll be really overwhelmed. So what I do? Now I call. Now I go. I talk with the OB/GYN. Now because I say, no, what do they do? This one, you know, there's no indication for cesarean section. So what do they do? No, observe maximum IPC. All the side we deliver the woman, we make sure say the other woman the way they be in the ball, then we put down the other bed with the far. And thank God that day, and only 2 belly women don't be in the ball. But we divide the staff there also. The one that they attend to that woman, they will get that extensive genital lesion. They not be interfered by the other treatment at all. We divide ourselves. And also deliver the woman. Thankfully, the woman progress well, and it deliver a bounced baby girl.
So the pikin not be get the sick at all?
The pikin not be get the sick at all. And we will be discharged them. The community where they go will be linked them to the surveillance team. They will they follow them say.
The woman survived?
Yeah, the woman survived. The one we survive, then we don't get any reports saying the pikin be ever sick.
Another challenge the response faced in its early days was a low laboratory testing capability. Port Loko, for instance, had relied on other districts to test its samples. As a nation, this especially impacted advanced testing capability like viral sequencing. Viral sequencing is the process of determining the order of nucleotides in a virus genetic material or genome, through which scientists understand its characteristics, evolution, and how it interacts with its host. This process is a crucial tool in diagnostics, infections control, and developing treatments and vaccines. WHO recommends for at least 8% of samples in a country to be sequenced. However, with only 2 laboratories with this capacity at the start of its epidemic, Sierra Leone could only sequence 1.7% of its samples. Port Loko was one of the beneficiaries of laboratory capacity building efforts during the epidemic. In collaboration with the Institute Pasteur de Dakar, an expert was deployed to work with local health authorities to establish this mobile laboratory in the district. This increased the country's capacity to conduct viral sequencing and overall lab capability for Mpox. The government also used all available diplomatic means to mobilize vaccines amidst a very limited global stock of vaccines. Sierra Leone received a total supply of 267,000 doses of vaccines by the end of its vaccination campaign, all at no cost, thanks to the generosity of partners like the US government, African CDC, Gavi, WHO, and UNICEF. Despite all of these efforts, breaking the chain of transmission will require more actions, from heightened surveillance and contact tracing to improvement in treatment and care, infection prevention control IPC measures, and expansion of the vaccination campaigns. Through Operation Find Them All, not only infected people were identified, but people at high risk due to interactions were also identified, traced, and vaccinated. In all this, health authorities were also having to deal with mis- and disinformation on and offline. Both patients and health workers also had to deal with stigma, which prevented some people from seeking treatment early.
When the Honorable Minister of Health declared we don't get Mpox on January 13th, it can't just happen. We can't get this USAID saga wherein they say Donald Trump don't reduce, most of the spending and we don't know the begin at this part of the world. So being that media and risk communication and we share some of them things and with platform and other areas then. So then we get this particular message maybe they go, during the internet they when you go a week, they get a case, then say go then when body people then because Trump say money they again, then make they see Mpox cases. It be really challenging for say how like colleagues and even educated people that we were all in at this medical game. They still they deny, say, I no go party this time money making, away money no day, and make the cases and not they go. And another peak again when we begin to get cases. I don't go to a community when the entire community they refuse, not for even talk to me. Yeah, because some people.
But I'm not ever convinced, not until we don't want to be. I've been a fetter over 2 months now. See what I've been a fetter. Treat antibiotics from one antibiotics to another. But the day when I left the antibiotic, at that time I can say, indeed, na Mpox I don't contract. And I begin worry. Okay. We look at how the treatment center and then a saloon, and how, in fact, I began to think about the previous outbreaks and how people then die. So I started calling my people. And indeed, so I called my brother and said, there's no way. But actually, what to make I call my brother now? I'm not be actually been for, but God be one for my recover. So what happened? I go meet me bishop. I tell her, I say, after church, it was Sunday, that time the fever, they disturb me now. I say, that time I don't begin to see small rush there now. Now I say, I don't begin to get what you say for this my body. Now he say, nah. I say, but people then tell me, say, nah, chicken pox. And he say, Max, you say, they only told me, Sabi, he say, but I should take pega. I'm a spiritualist and I tell you so I get no option. I don't know say now. It's not message from God. so let me say before they go reach the house, now send me pikin go buy 10 pega. And I want to smoke, and I want to drink, and I want to jam cola nut. So that was my first day when they brought the pega, and I down, I finished 4 of us. So I don't finish for, but where God not make you pass away they drink and try for relax for my sleep. I think say the fever they go, but it was unfortunate for me.
Never stigmatize it. Even though yes, we get some level of stigma against the one that will get the Mpox. Mostly the woman them, because they think say the woman them because of the get do moment that means with multiple people and that means they get the Mpox.
People they not really fully accept say na Mpox, you know the message will be they go around and they feel oh government just want to do this, just want to do that. They not until they start to see the severity of them. You know, even with management, we can be one for people in medicine, you say oh why they give me this medicine, you know, all that is fair. So I think it's not fear that being the problem. But we able to overcome them with counseling and we get a good team and we get a good psychosocial team. We will counsel them, we will talk to them. So with time we able to overcome some of them fears every.
This called for more community engagement and public sensitization. Every bit of available social capital was utilized, from engaging tribal and religious leaders to engaging the younger generation via the new media.
They're waiting at Mpox, and that's sick when they catch you. You body don't want me, then you leave the one that you treat, so begin swear. Then you begin put out water bomb on your body. Do you whether they happy no more? You not keep the people in the also. When I call one say be wanted. Let them care una let them can't test una. So tell them there, if you not catch this thing quick, it will kill you.
So when we all come together and get we for land for the water and fast the soap and clean water.
We deploy all the resources there. Everything, not to one bullet, not to one magic bullet. Everything, everybody, every institution, every partner, they matter. So all come on board, not to be one man work. Everybody come on board, everybody put hands on deck for make sure say we turn the curve. And as I say, it's not easy. We'll not be glad how the thing go, because we know say we don't deal with outbreaks than before. We don't do Ebola, we deal with COVID and last day on and off, but notwithstanding, this one was really overwhelming. As I said, we started with just 2 cases. We will register up to 5,000 cases. It not be easy, and there are a lot of challenges, but with the passage of Ebola, passage of COVID, Sierra Leone don't build a system. We don't strengthen the system, and we'll continue for strengthening the system. In any outbreak, when they come out of that outbreak, you'll make sure say you actually improve upon the health system, and that is what we have done.
From being the main lead in transmission of Mpox cases on the continent, Sierra Leone's handling of the epidemic served as an example. Health Minister Dr. Austin Dembe was even invited to appear as a special guest at the African CDC's weekly press briefing to share the country's experience as a lesson for other countries still transmitting the virus?
For me, it's a testament to country ownership, country leadership in creating a nimble partnership with government leaders, with traditional leaders, with civil society, with our development partners and our technical partners, especially Africa CDC. So very science-driven, very active case finding, identifying cases, sequestering the cases and managing these cases for their own health, and at the same time actively disrupting transmission. Again, it's a testament to all of us working together and putting actual P, capital P, in public health and ensuring that the public was the main partner in this kind of transformation. It's a lesson learned. It's hopefully a model for all of us to see that if African countries like Sierra Leone are empowered, are able to deploy their own resource and garner additional resources and strong partnerships, that we could contain an outbreak of this nature. For me, the important lesson here is that we understand this very well now, and what we want to do is to install systems. We want to be able to ensure that we have inbuilt systems now that focuses on prevention, rapid response, and containment.
But even for Sierra Leone, it has been a learning experience never to be forgotten.
As an agency, we do very closely with the Ministry of Health, so we owe personnel, the Ministry of Health personnel, we now will take the forefront. We will not be depend on partners then as first choice. Now we as individuals, as indigenes, as locals, as nationals, now we take the first step. I mean, even with funding, it happens the government now the first body will provide $1.7 million for this response before any other partner come in. So we as a nation now will take lead on this one. We'll not be actually have open partners, though we'll not drive or demean their role, but now we will take the lead. We'll start initially with the challenges of late resources, but as I say, government come in handy, provide much resources, other partners that come in, African CDC, US CDC, WAHO, other people that come in, but definitely have a challenge. And then also start again because, as I say, because of the limited amount of vaccines globally, that also have been challenged. But with the advocacy of His Excellency the President and the Honorable Minister of Health, they're able to mobilize some of them, vaccines them, or deploy. So challenges them in there, but in life itself is full of challenges. You give us a mountain.